So one of the problems of people who've seen my videos on YouTube is that I only have a limited number of stories. So since you've already seen those stories, but I'll do it again anyways. So we have a lot of claims. One of the claims, for example, is that I say that the MGB is good in that many of our diabetics have their diabetes go away. In a recent survey of about 2,000 of our patients, 93% of diabetics were not taking any diabetic medicine. So that's pretty cool. Sleep apnea, high blood pressure, a lot of things. And one of the things I haven't measured, I don't have numbers on, is headaches. So I can't give you precise numbers, but I can tell you for sure that there's a couple of things that you might want to know about, and your husband has already kind of seen the video, so I'm just repeating this, and that is that obesity and weight are associated with high blood pressure and diabetes and osteoarthritis and a whole batch of things, including swelling in your ankles, joint pains, shortness of breath, high blood pressure, heart failure, sinus problems, and headaches. And all these potentially can be related to the fact that the body just retains extra salt and water. So extra salt water pumped into your ankles means you have swelling in your ankles. Extra salt water pumped into your lungs, and you're a little short of breath. Extra salt water pumped into your bloodstream, and you have high blood pressure. Extra salt water pumped into the sinuses, and you just have a little bit more allergies and sinus problems. But extra salt water actually pumped into the skull, when the skull is a inflexible, bony box, means that the pressure goes up, and high pressure hurts in the brain. Okay? That's what, when people have a brain tumor, the majority of the time when they come to see the doctor, it's because the tumor has enlarged and caused the pressure in the skull to go up, and high pressure in the skull hurts. Now there's something very unusual that heavy people get called idiopathic intracranial hypertension, also called pseudotumor, false tumor cerebri of the brain. Somebody's heavy, they get so much pressure in the skull from the cerebrospinal fluid, it actually begins to hurt tremendously, and the pressure can actually pinch on the optic nerves and cause blindness. And in my series, I've had 4 patients who had pseudotumor cerebri. We did their surgery, their pressure went down, and their vision came back. And their headaches went away. One works here, there's one from North Carolina, and so it's just been a wonderful experience. But back to headaches in general. Lots of my patients, when we talk to them, have headaches pre-op, and many of them, and I'm embarrassed I don't have the exact number, their headaches go away afterwards. So I would predict there's an excellent chance that your headaches will go away after surgery. Another question I think that was embedded in that, maybe more like what you were actually asking, is what happens if I do get a headache post-op, when you said I'm going to have all these medicines I usually take removed from what I'm allowed to take. And so we know the answer to this question. Lots of my patients have headaches pre-op, and prior to surgery, they had access to all the drugs at the grocery store, the drugstore, at the pharmacy. And after surgery, we take those drugs away. And what we've heard, essentially from everyone, is they always prefer this life as far as the overall incidence of headaches in their life. Now, there are people who, after surgery, occasionally get a headache. They always have told me they have fewer headaches and are not as severe. But they do say, oh, now I've had a headache. I only had one this year compared to one every week beforehand. But I do have this one this year. Can I now take something to go from 90% better to 100% better? And my advice is, perfect is the enemy of good. If you have a tremendous improvement in your joint pain and this and that, do you really think it's wise to take something that might cause an ulcer for that one pain out of a year when you used to have pain every week? So there's no absolute right and wrong answer. Certainly, you're allowed to do anything you want post-op, but in general, we predict, my experience has been overwhelmingly that your incidence of headaches and the quality of your life is going to improve tremendously as the incidence of headaches goes way down after surgery. Now, if you're faced with one day out of the year where you have a bad headache, can you take one Tylenol? Can you take one aspirin? Since I'm recording, the answer is no. But taking one Tylenol is not the same as shooting yourself with a gun. Taking one aspirin tablet is not the same as, jumping off the Empire State Building. The damage from aspirin and Tylenol and drugs like that requires more than just one tablet. So if you were to take one tablet or one dose in the coming year, that might be okay, but I'm going to cut that part off of this video. It turns out that when I tell patients things, they don't always listen. So if I were to say you can occasionally take a Tylenol, people would be taking a lot. When I tell people, as I do every day in clinic, never ever take a Tylenol, they take some. So I'm telling you again, don't take any Tylenol, aspirin, or anything. And I think overall, you will be like my other patients, very pleased and satisfied with the results of surgery and much less suffering in your life post-op from headaches than you ever had before, even though we're going to pull away all those medicines. If I'm not correct, you need to let me know, because I haven't tested this as rigorously in surveys and science as I have some of the other numbers.